I just wanted to welcome you to our webinar. I know that all of you have gone to numerous webinars, and you do have a choice now to log on to multiple webinars per day. The reason why I asked our guest here today to be part of our webinar series is because they are in the trenches. They're making sure companies are compliant, they're making sure people are getting tested, and they have some of the best practices as well too. So I wanted to invite partners that can literally give you real-time data information to help all of you. You've already returned people back to work. They're already getting sick, and what do we do? The biggest questions that I've been getting from clients are testing. So we're going to do a deep dive into testing as well too. So I wanted to welcome all of you that are here today. We do have a virtual packed house. Just some general housekeeping items. You have the control panel there on the side. So please make sure you put on your questions there. We will filter through them. For those of you that are not camera shy and are not shy to bring up your questions live, for those of you that have a lot of questions, I might unmute you so you can talk to the panelists here today. Also too, just as a note, this is not legal advice. We don't pretend to be attorneys, correct, gentlemen? That is above and beyond our pay grade. This is just some general information of what we're seeing, some best practices, and we always just want to encourage all of you that what we're talking about is here and now. Will this be outdated tomorrow? Probably, unfortunately. It's a moving target. I think we're all in the same space, and once we get to know, okay, I think I have this under control, and then getting dinged with another Department of Labor or a CDC update or a World Health Organization or LA County, and it's just this constant learning curve. So again, this is information only. All of you probably have in-house counsel or you have a labor attorney, so we definitely want to guide you to those folks for any legal type of questions. This is just general information, but we do encourage all of you to make sure you have the latest and greatest in regards to federal, state, and your local municipalities as well too, and share with one another as well too what's going on, what's happening as well too. But those are my general housekeeping. I'm so excited to bring these gentlemen on to talk about compliance, something that is near and dear to me, kind of a nerd about it, because I think it's so important. Compliance and safety have always been part of the fabric of S&K because it ties into your risk in insurance and allowing us to protect you. But safety is the new requirement. And so I'm so excited to have the folks here to give us some general information and to give us kind of the best practices as well too. So I want to introduce, we have Henry Liu, we have Ted Schwab, and Neil Bybeck here, that they're going to be giving you some different pieces of information. They're going to be little experts within their domain, and so they're going to be talking about several different parts of compliance and also diving into the various testing as well too. So gentlemen, thank you so much for being here today. I'm hoping my clients don't pepper you with too many questions, but be on the lookout as well too. But again, make sure that if you guys do have questions, you have that control panel there on the side, and you put in those real-time questions that you may have for our presenters today. So first up is going to be Henry Liu, and as you can see there from Hew and Associates, I'm so happy to be partners with you all, and Henry is going to be going over the first part of the presentation.
Thank you, Tony. First off, I want to thank Tony for really inviting us to participate in this webinar. I found that she's someone that really cares about you as your clients or associates and colleagues, and I have the utmost respect because there's so much information out there, and a lot of us that consider ourselves experts, but we all know our own lanes and we all know where our expertise lies. So Thank you, Tony. Really appreciate the opportunity. We're going to cover a few areas today. We're going to talk about safety considerations and self-audit. We're going to utilize the Cal OSHA, CDC, and Department of Health guidelines. And then last but not least, as Tony mentioned, we're going to cover the tests, the two most prominent tests that are happening now and that we are administrating. And so we're going to try to cover these areas. There's a lot of overlap in the first two categories, but we'll try to put them in the right context as we move forward. Okay, next slide, please. Okay, as we look at the guidelines that are presented to us, I really look at it in two ways. What is ideal and what is realistic? And so, as you'll see, the difference between the ideal and the realistic is an ocean. And so it's based on feasibility and the ability to really apply some of these guidelines. But I want to share with you one, if you can go to the next slide, please. Thank you. There's two areas that are ideal. I know all of you are, today is opening day, I think, or this week of baseball. And there's guidelines. And as I've read through the guidelines, I'm amazed at how professional sports has taken the forefront of doing what is ideal. And so today, what I'd like to share with you is I've kind of synthesized the 113-page criteria that the NBA is using, but I find it very interesting. And I'll kind of share with you, and then what we can take from this. So first off, what the NBA has done is they've invested $150 million in creating what they call the bubble in Orlando, Florida. We call it Disney World, but they call it the bubble. And in doing so, they've taken the guidelines that are provided that we've mentioned, and they've kind of created them to fit their needs by still utilizing the guidelines. And I think they're really interesting. What they've done is they've created 6 phases. Week 1, the phase that they've utilized is really returning players back to their home market. And the team facilities may be open for voluntary workouts, but there are no group activities. So what they've done is brought them back to work, but said you can't commingle with your colleagues. You have to work on your own. Phase 2 is similar to phase 1. Phase 3, which is week 3, July workouts for players now will be mandatory, and there's no group or team activities allowed. Players and staff are expected to continue quarantining rules, and regular COVID-19 testing will continue. Phase 4, and I'm kind of shortening these from the 113 pages. In the 4th phase of the process, the group and team activities will now be allowed. As with the pre-Orlando guidelines, players and staff will continue to be regularly tested for COVID-19. Phase 5, along with continuing practices and group workouts, teams will begin playing scrimmages against opposing teams, and each team will play 3 scrimmages during the portion of the plan. And as always, everyone will be subject to regular COVID testing.
Wow.
Phase 6, regular season games will begin on July 30th, and all rules from phase 5 will remain in place. In addition, any player that chooses to leave the campus at any point will be required to go through an additional testing and quarantine period. This is where it starts to get really interesting. Now, when the testing is implemented, as expected, the league is implementing stringent testing rules. Beginning with phase 2, which starts on June 23rd, players and staff will undergo regular COVID-19 testing. To start, that will include a PCR test, that's the nose swab test that Neil will go into more detail, a typical throat or nasal swab, along with the antibody test. All subsequent testing will be PCR tests unless otherwise necessitated. What's been publicly presented is that they're going to be testing every day.
Wow.
And they're going to minimize any gaps in between the test to secure baselines on a daily basis. During the pre-Orlando phases, household members living with players will also be tested upon arrival in Orlando, and players and staff will need to self-isolate in the rooms until they return 2 negative tests within 24 hours. Everyone staying on campus in Orlando, including league staff and broadcast and game day operations, staff, media, etc., will stay on campus and will not undergo any testing. On-court safety measures. Simple, disinfecting the basketballs. They'll practice good hygiene. That means you can't lick your fingers anymore, which changes the game of basketball. Taking out your mouth guard or wiping your shoes. So basically, if you watch basketball, they lick their fingers and they wipe their shoes at the same time. That is prohibited.
Wow. That's going to be a new habit then.
Yes, and that's a yeah.
Yeah. Okay.
Right, Tony? This is a guideline, and I watch a lot of basketball, and they do everything that they shouldn't do. But what I'm trying to demonstrate is really how they've taken the guidelines and they've molded it towards their industry and what they have to do. They don't have to wear masks, but players don't have to wear masks, but coaches have an option, and everybody else has to wear a mask. Here's where it gets really interesting. High-grade, high-tech gadgets. The league will use to keep players healthy is technology. First off, on campus, they will be required to wear magic bands, which are bracelets that not only serve as hotel room keys, but will allow wearers to pass through security checkpoints and check in for medical testing. Proximity alarms. One device is the proximity alarm, which is basically something that the player wears and allows him to know if he's coming within 6 feet of another person with a proximity bracelet.
Wow.
Within 5 seconds. The team and league will be required to use one of them as the alarms, and they will be optional for players. The alarms will not collect GPS locations or other data. Biometric ring. Basically, this is a ring that captures any data that shows that if the player has any symptoms, that he has high blood pressure or anything that's biometric would be related to a central source. Then they have socializing guidelines and what have you. I think the real thing is there's maintaining social distancing, using own equipment, there's food guidelines, eating, restaurants who deliver food is defined. I think what's the last thing that I want to share is that they also have a snitching hotline. So basically you can tell on other players that are not following the guidelines. What can we take from these guidelines? For most employers, they're not feasible. They're not financially feasible unless you have a company that generates the revenue of the NBA, Major League Baseball, and the NFL, or something similar. What we really have are the realistic guidelines. But why I presented this to you is that in my perception, and as I talk to my colleagues, Ted and Neil, this is really what we need. We need constant testing.
Right.
We need to be monitored. We have to be, and the other part of that is held accountable. It may be over the top, but it's ideal to help us mitigate loss and, help us get back to work safely and stay work safely. So that's why I wanted to present to you. That's the ideal scenario. It has a lot of restrictions. I'm a sports fan, so it changes the sport for me, but it's their way for these professionals to get back to work.
I think
Next slide, please. Go ahead, Tony, please.
It's great to know that here's the most extreme, right? Yeah. And the millions of dollars that they have, right? And so I think that's great. I really think that's great to know. This is the extreme. Do we have unlimited budgets? No. But could we take some of those best practices and custom make them for your specific company as well too?
Exactly. Somewhere within the Cal-OSHA and the Department of Health guidelines is your plan. And that's what I want to present to you, is that you look at what really works for you, the type of work you do, and then we implement. Well, what's realistic? Well, what we use is we have the Department of Health, we have the CDC, we have OSHA, Cal-OSHA guidelines. They're very similar, and there's a lot of resources out there for you. Fortunately, what we've done is we've kind of synthesized them. There's a lot of overlap, and so what we're trying to do is look at two different scenarios as far as my presentation and kind of present to you what we work off of and what you can work off. What I want to tell you is that after the presentation, if it's requested, I'll be happy to send you any of the links to all of these. There's a ton of information. There's a lot. So really what we look is realistic is what do? We'll follow the Department of Health, or we'll follow Cal-OSHA or OSHA guidelines. And that's kind of what I want to quickly kind of present to you. And the scenarios are very similar, or the criteria is very similar, but the first one is scenario number 1. Employees are currently at work. Can you flip to the next slide, please? Oh, I'm sorry, you're fine, you're good. Really what we're looking at is what is the next one. I'm sorry, you're doing a better job than I am, Tony. Next slide, please. We're really looking at a few things. What is your written workplace specific plan? I'm not going to go through everything. I think you'll understand as I go through some of the audits or some of the checking points that you'll see they're pretty self-evident. But the first is, what is your written workplace? What is your written workplace and your specific plan? And really, if you identify persons or a person to implement a specific plan, it's really important. It's important to do it for preventative and proactive reasons. The other is a risk assessment and the measures that will be taken to prevent the spread of the virus. Use of face coverings in accordance with the Department of Health guidance, training and communication with workers and worker representatives on the plan, process to check for compliance and document and correct deficiencies, a process to investigate COVID cases, alert local health departments, and identify and isolate close workplace contacts and infected workers. Protocols when the workplace has an outbreak in accordance with the Department of Health. There's a lot of checkpoints there, but what you really have to know is this is all in place for you, and all you really have to do is create the guidelines. I'd encourage you to consider doing that as you move forward. The next is topics for worker training. Basically is, are you providing a training, appropriate training for all of your employees, preventing spread, and who's especially vulnerable, right? Do you have awareness of your employees, their histories, where they're working, the physical space, and is that documented? Self-screening at home, including temperature and or symptom checks using the CDC guidelines. Are you requesting that, or are you providing it and making that easy for your employees to have access to that? The importance of not coming to work if others have a cough, fever, breathing, really it's any of the symptoms that are related to the COVID-19. And on that point, if anybody thinks they have an allergy, which is not listed, you should address that and look at the different areas. I could expand upon that, hopefully Neil will, but yesterday they talked about temperature testing and how it's a good process to test people when they come to work, but there's ways that they fail. One is the equipment that you use, and also secondarily is if somebody thinks they have a little cold, but they take an anti-inflammatory or a Tylenol, they reduce their fever, they come in, they're kind of asymptomatic, but they're spreading the virus. So there's different things that we have to look at. To return to work after the COVID-19 diagnosis, only after 10 days since symptom onset and 72 hours with no fever. There's a whole criteria of this as far as topics for training. The second category is individual control and measures and screening. Symptom screenings and our temperature checks. Encourage workers who are sick, exhibiting symptoms of COVID-19 to stay home. That's really paramount. If they think they have an allergy, they should stay home until proven differently. That is very important for us to really recognize. And if you're going to err on the side of being conservative and keeping that person at home. And if you've created the ability for that person to work from home, that's all the better. Encourage frequent hand washing and use of hand sanitizer. So at my house, I have hand sanitizer at every entrance of the door. My wife is very good at this. We wash our hands. She counts to 20 while we're standing over the sink. There's things that you have to do. And what I would say is this is what I tell her. I kind of tire of washing, using hand sanitizer, disinfecting, but we've been very blessed and very fortunate that over the last 4 months, none of us have gotten sick. So it works. So I can't refute that. Provide, ensure workers use all necessary PPE. This is really key, and it's not only necessary, but it's appropriate. If somebody is, the best right now that they're talking about, and everybody, the CDC and the LA County Department of Public Health is saying, not only do the masks prevent the droplets from coming from an infected person, they also protect you. And to qualify that as far as PPE, and there's other types of PPE, is that you have to use the right masks. I see masks that aren't working, and masks are the best protection right now. So it's really to make sure they have adequate, 3-ply, disposable, but not have their if I could say this, LA Lakers t-shirt cut into a bandana covering their face coming to work. And I see a lot of
I saw that.
fashionable.
I saw that yesterday, actually. So
Yeah.
I think those are all great reminders. And, going back to that individual control measures and screenings, we have one client that's on the line here, and they actually have the CDC poster, and they told all the employees to put this up in your house. And they also reminded them, hey, don't worry about it. We have this emergency sick. So if you do have symptoms, as collectively trying to keep us all healthy and safe, if you have these, look at that list before you even get in your car to come to work, right? Because what we hate to do is take your temperature and you have to leave, right? So help us help you, help us control this for your coworkers, for the health of the company. But it is a nice kind of reminder as a checklist. And I do have a couple of clients that are on here as well too. They actually gave their employees a quiz and said, what are the symptoms? They had about 20% of people that actually got it right. So we may think we know, but we may not know it off the top of our head. And so I think that's really important. You talked about PPE. What I'm hearing from my clients is, well, one size doesn't fit all, and agreed.
Yeah.
This is itchy. I'm getting fogginess. I have asthma. I have these different things. And so what I'm seeing is people having 3 different types that all meet criteria. So that way, if there is any pushback, they can say, well, I have this, and this as an option, but you have to wear one of them as well too.
Yeah, absolutely. That's really important, right? And it really, as far as the mask, because of the importance of it, is finding a mask that fits you. I've bought every mask that I can imagine. I've been given masks by my healthcare clients. I can't use the N95s. I can't breathe and talk at the same time. My face is shaped differently, but find one that's appropriate. Provide disposable gloves, and that really just goes with PPE. And that's really if your work environment really entails that being a benefit, having work gloves. Post signage, as Tony said, not only at home, my wife posts on the door, take your shoes off. Then we sanitize the shoes outside when we're in public spaces, but post signage. Cleaning and disinfecting protocols. I'm going to just kind of skip through most of it, but it's really looking at high traffic areas and places where people touch. And that goes at the coffee room. In my office space here, we look at the coffee room. It's very sanitary now, separated. So we're not standing in line to get coffee. But just things that you need to do. It's all common sense, but having the appropriate, they talk about making sure that you have hand sanitizer, not the ones that are more fragrant, but at least 60% alcohol based is what they look at. Physical distancing guidelines, which is really important. That in regards to everybody understanding 6 feet, but if I can share with you, physical distancing is 6 feet depending where you're at. As far as I'm concerned, 6 feet in an elevator should be 8 feet. If you're 6 feet and you're outdoors, it's different. And we have an elevator in our building here, and they put the stickers in each corner. And when we go in, if there's more than, I usually wait, but if there's 4 people, they want us facing the corners, facing away from the door. It's really weird, but I understand why they do that. That's the guidance of the building owner to do so. So that's physical spacing. Okay. I'm going to kind of go quickly in a different scenario, bring employees back on site. There's a lot of duplication. I'm going to briefly go through this because of time, but there's kind of, these phases are concurrent with what our reopening phases of America, phases 1, 2, and 3. And we look at these phases and just to kind of to go through and go back. Phase 1, businesses should consider making telework available. So is telework available and an option to your employees? That's during phase 1. When possible and feasible business operations. And for employees who return to work, consider limiting the number of people in the workplace. It's really a lot of common sense in regards to phase 1. Phase 2, businesses continue to make telework available where possible, but non-essential business travel can resume. Limitations on the number of people in the workplace can be eased, but continue to maintain moderate to strict social distancing practices. So in our lobby, we have partitions, we have stickers, so when They come to our reception area. We have like a grocery line and people stand.
Right.
It's very important. Social distancing is one of the top key components to helping us mitigate. And then phase 3 is when we're reopened, when we can go to baseball games and we can go in public areas, and then really, I would say stay. At that time, I'd say practice what you did in 2 until everything is 100% back to normal, whatever that was prior to this. Few things, and regarding to the guiding principles that are provided by OSHA, it's really hazard assessment, including practices to determine when, where, and how, and to what sources of SARS or the COVID workers are likely to be exposed in their course of their job duties. So this is right in Tony's wheelhouse in regards to risk management. You have to do an assessment.
Absolutely.
If you're a hospitality company, white collared, manufacturing, what is your risk? And you have to assess that. Hygiene is what we've talked about before. Social distancing, really important. Whoever created the word social distancing, I have to say that there's going to be t-shirts out after this is done, but it's really making sure there's space. I can tell you I've walked into hospitals where they're supposed to have the seats, the chairs separated, and all somebody did in the morning was push them. Some were 3 feet, some were 6 feet, some were 10 feet, some were 2 feet. You really have, 6 feet is the minimum. That should really be the guideline. It's minimum as far as distancing. Identification and isolation of sick employees. So you bring employees back to work, you still have to identify that, you have to have a protocol in place. Ted's gonna touch more on this, return to work after illness to exposure. So when somebody's been sick, when they come back to work, how do you deal with that? Controls, including engineering and administrative controls, safe work practices, personal protective equipment selected as a result of the employer's hazard assessment. That goes back to point 1. I'm at risk. What do I have to do to control that, to mitigate, to lessen the risk within my workplace? And then we taught, this is kind of over and over again, but workplace flexibilities. Can we flex work? Can we have people work from home some of the time? Can we change shifts? Can we have people that are essential in only? That's really a choice that you have to make or your clients have to make. And then 2 last points. Training. What kind of training are you willing to put your employees through? It doesn't have to be extensive, but it has to be concise. The rules and the regulations, if you take the time to read through all of them, they're very concise. And you can have creative, you can take them and like the NBA, make them work to your best ability, but what is your flexibility within your workplace? The last, what I think is really important and that I think is a concern is anti-retaliation. This is part of the OSHA guidelines to have policies and procedures up that you won't retaliate, and you retaliate as far as an employee. You ensure workers understand their rights to a safe and healthful work environment. I can tell you friends of mine and people that have worked in health systems throughout, I'm just saying this in general, are concerned that they're not working in safe environments and don't want to say anything because they're concerned about retaliation. These are things that are addressed in the OSHA guidelines. So they want to make sure that the employer lets the employee know that they have rights to do so. They ensure workers understand the right to raise workplace safety and health concerns and seek an OSHA inspection under the Occupational Safety and Health Act. I think I've covered all the criteria, and I do want to tell you, I know that a lot of it crossed over, and there's so much more that we could share or I could share in regards to these topics. But the one thing I want to reiterate, and the reason I shared the NBA is that not one size does not fit all. I work with smaller employers, and I work with employers that have 15,000 employees. And really, one size doesn't fit all. After 29 years of corporate wellness, I never thought I'd have to advise clients on these topics, which is just new for everybody. So don't be frustrated if some of this is redundant. We have to find out what works for you. You have to find out what works for you or your clients and customize it. But know that there's a few guidelines. It's social distancing, It's having the correct PPE and screenings. Okay, we'll talk about that. Neil will cover screenings, but that's it for right now. And at the end, we'll answer any questions that you're interested in. Now what I'd like to do is introduce my colleague, Ted Schwab, who's going to share with you other topics on the screen right now. Thank you.
Do you know what, Henry and Tony, because we're at the bottom of the hour, Henry and I, a lot of our presentations overlap, but I do want to make sure that we get the discussion about testing in here, and Neil's the expert on that.
Okay.
So Tony, what I'm going to ask if we can jump ahead to Neil, and then with time left, we'll come back to me, because I do want to make sure we have time for questions, and Neil's is so important.
Absolutely.
Neil, is that okay with you?
Yeah, I'm fine with it, and I don't expect it to take that much time. I just want to make sure everybody understands it. That's really important.
All right, then Neil, and then so we'll just play a little bit of pickup basketball here, and when you're done, I'll come back in.
Sounds good. Sounds good.
Thanks, Ted.
Thanks, Ted. Hello, everyone. I wanted to help you all understand some, or at least provide more information about testing. It's currently very confusing, and the guidelines are not that strict. So we really like to evaluate each situation to determine which testing is better. But I think that after this presentation, you'll have a better understanding of what these tests do. So let's move to the next slide, if we can, and go into really what are the tests and what are the differences between the tests. So I'll start with antibody tests. It's also known as serological tests. And I think all of you have probably seen tests or heard about tests that take only a few minutes to get results.
Correct.
Those are not the tests that we recommend. I mean, it would be great if we could get everybody's results very quickly. However, there are a lot of false positives and negatives with those, and we'll discuss that a little bit later. The tests that we recommend look at several different types of antibodies, and that's really important. And antibodies develop after someone has been infected. So it's usually for an individual who has previously had infection. Now, there are different types, as I mentioned, different types of proteins. So the IgM protein can identify potentially somebody who is still infected. So when you do a quick test, it's either yes or no, positive or negative, but you don't really know if they have any active infection. So it helps us to know if we offer different tests that can identify more types of antibody, it gives us a better perspective on how healthy that individual is or how sick they are. The other test, also known as PCR or virological testing, looks at active virus. So it's looking at the genetic material, it's looking at the RNA. And so individuals who have active infection will show positive in 90-some% of the cases. Again, it depends on the type of test we use. I'll go into how those tests are administered a little bit later, but I want to clearly let everyone know that the PCR testing is typically what we do for employers when they have employees on site or when they're looking to open up, because we want to identify if those individuals are currently infected. Now, if you have an employee that says, I'm sick, they should not be coming to work, period. And if you are testing them to see if they should come back to work and they show some disease process, they should not come in for testing. They should test elsewhere. We don't want to bring an infected individual in to the workplace, even if they're masked and they're social distancing, we don't want them in the workplace. Risk goes up substantially for cross-infection. And I just wanted to mention, because Henry mentioned something earlier, you know, if we're all masking and we're all washing our hands and we're all social distancing, individuals shouldn't even develop colds because we are protecting ourselves. So people in some ways, if you don't have underlying disease like asthma or other factors, may actually stay healthier, because if they truly maintain the these except in their own homes. And if everybody is healthy in their own homes, there shouldn't be any cross-infection of any kind. Let's move on to the next slide. So a lot of people want to know which is the better test. And again, we mentioned that for serology tests, it's for individuals who feel they've had or been infected before. And so at an employer site, when we're first testing, we may offer both PCR and antibody testing. And just like the NBA, they may be getting both testing initially. Now, if they are negative for PCR, so they're not showing active virus, and they are positive for previous antibodies, they may not need to be retested.
Okay.
The problem exists, we don't know, when I say we, the CDC, everyone in the science community, we don't know how long the antibodies last. So is it possible for somebody who shows a positive antibody test, they show the IgG protein, which means they've had previous infection, but they don't show the IgM, so they don't have current infection. Are they immune from getting this disease again? And that's something we don't know. So we may want to retest them periodically. All right. But for most individuals that are, as an example, we have a client that we are testing every week.
Right.
And they have about 2/3 of their employees in-house and 1/3 working at home. So they bring those employees in 1 day a week. It's an opportunity for them to have some meetings as well and have everybody on the same page, but at the same time, social distancing, masking, they choose to wear gloves, they sanitize their entire facility on a regular basis. So that's really important. But when it comes back to testing, typically we will do the PCR test. And the PCR test will let us know when there's active virus. Now here's another caveat, because there are potential cracks in the system.
Right.
If someone is negative, but they've been exposed, they may be developing the disease process. They won't test positive for antibody because they haven't had time to develop it, but they may not test positive for the nasal swab either, or the PCR test, because they don't have enough genetic material to come out positive. So that when we retest, by then they should have, of course, if they develop symptoms, they have to go home. But we do retest to make sure that they are not now positive where they were negative before. Now we have another client. It's a major band, musical band that everybody knows about. They are on tour, so they need to be tested every other day because there's so much exposure for them. So we try and we'll discuss how quickly we get results in this presentation, but for individuals that need results immediately, there are special labs that can help us with that as well. All right, so let's move on to the next slide, because I think I'll make it as easy as possible. So when we talk about how the tests are administered, the antibody test, as I mentioned, there are tests that use a finger stick, or they may use a finger stick and pipette out a certain amount of blood. Those tests are limited. However, there is a place for them, and but there are more false findings with those tests. The test we use uses a full blood draw. So there's plenty of material there to help identify, and our false positives and false negatives are very, very low. With the PCR test, unfortunately, that test, there are tests for PCR that use a swab in the mouth, but those have not proven yet to be 100% effective, or even 90-some-odd% effective. We still use the conventional nasal swab. Now, not to scare anyone, however, this nasal swab, I've seen it done by our hospitals where they help educate the individuals so that they do it themselves. However, I have found that people get squeamish, and to do the test effectively, they are just unable to do that, but the individual who's testing may not know that. So we have a clinical individual that comes out to the employer and provides the test, and it is a nasal swab that goes into the nasal cavity beyond the nose.
Yeah.
It's twisted for about 15 seconds, twirled, then brought out, and then it goes into the other one. And actually, it's not terrible, but eyes always water, so I always advise people grab a tissue before we start.
Right.
And we accept any swearing or anything that somebody might have during the test. It's understandable, but for the most part, it's not really that bad, and it's only about 30 seconds of testing. So those are really the differences between the tests. Let's go on to the next slide. So we mentioned false positives and false negatives, and what are they? So we all know that a false positive would help identify if somebody, certainly was positive for the disease, but in fact they did not have the disease process. However, false positives are a very small percentage of what we find. But if somebody tests positive, regardless of whether it's false or not, until they are retested, they have to be treated as if they're infected, and they have to self-isolate. For false negatives, there's always that possibility. With the PCR testing, not as much, because if we administer the test, we're getting enough RNA, which is the material, the genetic material we're looking at, to help to ensure that the test is more accurate. And PCR stands for, it's polymerase chain reaction. And what it is they change the temperatures of the samples and actually enhance the genetic material so that they are able to identify positives more accurately.
Got it.
All right, I think is there another slide, or is that it for me? Laboratory test turnaround. So that's very important for a lot of people. I mean, it would be great if when we do it through our hospitals, those are drive-throughs, we're getting 2-hour results. But that's not really practical at the workplace, because we have to take those samples and submit it to the lab. So it's not till the next day that the lab looks at it. So in ideal situation, 24 to 48 hours. However, it has been taking longer, and it's because there's such a strain on the system that it can take for us 3 to 5 days. And usually it's 3 days, but if it's over the weekend, then it could take 5 days. But if we're testing on a weekly basis, we want to at least know 1 or 2 days before retesting if that individual is negative or positive. So that's very important. So unfortunately, I think that things will get better as testing catches up and as the laboratories catch up as well. There are some very, very large laboratories that are just totally overwhelmed. So, but with the PCR testing, not every laboratory can offer results for that, can process those. So that's another consideration as well. So I hope I've answered many of your questions. However, I'm available after the presentation as well to help answer questions. So if you do make notes here, this is the time to let Tony know if you do have any. So thank you again for your time. Hopefully you have a better understanding.
Thank you, Neil. I have a lot of acronyms in my head right now. And I think it's really important for people to know the differences between the tests, and also too, if they are sending people in to go get tests or getting results back, they know the differences as well too. So thank you for the IgG, the IgM, the PCR. Thank you for
good, very good.
All right,
thank you. I'm going to bow out right now, so thank you.
Thanks. Ted, what slide do you want to start on? As we've talked about the compliance side, preparing, we talked about the testing side. Is there a particular slide that you wanted to start on to kind of wrap it up?
Yeah, Tony, I also want to make sure that we have time for questions.
Sure.
And so I'm going to give a very quick overview. So just go back to the beginning of my presentation, and I'll just speak for a couple of minutes here. And So, you know, folks, as we talk, and Tony, can we give these slides to folks after the presentation?
Absolutely.
And so what we've done here is taken a common sense approach to the overlapping and sometimes confusing regulations and put in a step-by-step approach of the questions that you need to ask yourself. And then rather than going through the 7-step process here, let me just talk to the folks on the webinar about how we're approaching it and how the companies that we're working with are approaching it. The first thing is some rules of thumb. And just think, folks, of 3 things. Number 1, like unless you're Tesla or the LA Flower Mart, there's not the OSHA police that are going to come in and look to shut you down. If you are a very visible company and you're dealing with the public, you might want to submit a plan ahead of time to the county. But by and large, you know, let's be clear, there's not the OSHA police who are coming in to shut you down. What OSHA and the county and the CDC are all very clear about is that you, as an employer, you have one responsibility only, and that is to protect the safety and wellness of your employees. If you go in and look at the regulations as we have, the regulations themselves are pretty doggone thin. The guidelines they give you, the voluntary guidelines they give you, are very, very deep. So number 1, think of how can I keep my employees safe? The second thing to think about is make the assumption that the virus is everywhere. As you're going through putting in your social distancing practices, your face mask practices, your deep cleaning practices, your virus abatement practices, and your testing practices, almost assume that the virus is everywhere. And what can I do as an employer to make sure that it doesn't spread? The third thing is that there might be a day of reckoning where people come back and ask for what you did. And so make sure you keep records. Make sure you track what you're doing. So now I'm going to run through the 7 steps, and I'm going to do it just very quickly and give you one piece of advice for every step. The first step is, can I reopen? And unfortunately, this isn't a Cal OSHA regulation. This isn't a CDC regulation. This is the county. And if you look at LA County, it's really clear what can be open and what cannot be open. If you would go to step 2, the second thing is to check your industry. There are 33 different industry categories. They're very clear on the OSHA website. The question we get all the time is, well, what if I look like a number of different things? So for example, you're a large construction company. There are construction regulations that you have to, there are construction guidelines that you need to look up and try to follow on site. But let's say you have a large office staff that oversees your large construction company. You have to go into that part of your business and look at it as if you're an office building and follow those guidelines. And let's just make it more complicated and say you have a child care facility on site. Now you have another set of guidelines. So the general rule is, what am I doing? What business am I in at that specific geographic location? And then go to those guidelines. Let's go to step 3. And this is probably the most important, is 1, have a doggone written plan in place. If you are ever required to answer to OSHA, they want to know that 1, you have a written plan, 2, that written plan has to be available to your employees, and 3, if you're customer facing, it has to be available to those customers. The second thing about step 3 that I like to think about is you need 1 person in charge. You might have many people applying the plan, but 1 person has to be the fulcrum or the focus that manages your written plan. Let's go to step 4. You know, people always ask me, what's the most important interface with employees? It is train, train, train. Communicate, communicate, communicate. That's part of your written plan. That's part of your policies and procedures. And as you read this after the fact, you can go through the different things to train about. But again, it goes back to those rules of the thumb. How do I keep people safe? I'm assuming the virus is everywhere. Let's go to step 5. Step 5 is, what controls have I put in place? So for example, as Henry was talking about, do I have masks for everybody? Do I have hand sanitation for everybody? At the onset of an outbreak, do I have a deep cleaning practice in place? Do I have a virus abatement plan in place? Am I tracking people daily with those attestations? Let's go to step 5. I'm sorry, step 6. The cleaning and hygiene policy couldn't be any more important, folks. And there are 2 things to think of in these many steps. 1, what have I done up front? And what do I do at onset? How do I go deep cleaning when there's an onset? What am I doing to prevent? Let's go to step 7. And this is about the social distancing that we've all heard about. How do I limit the number of people in my facilities? When I can't, what have I done with the barriers in place? You know, the ubiquitous plexiglass that we all see. And how am I putting the barriers? And how am I posting reminders to folks that to social distance? Sort of in closing, before we go to questions, let me go back to my opening remarks and say, you know, I guess my first piece of advice is take a deep breath. You'd be bombarded with questionnaires from different consulting firms. I'm sure law firms have reached out with policies and procedures. Take a deep breath. The folks that we're talking to out there in the field, and this is dozens and dozens of companies, there isn't somebody out there looking to turn you in. There aren't the OSHA police. People understand that these guidelines are evolving over time. And the general rule is folks are looking, or OSHA's looking to people who are making their best effort. Are you tracking? Are you keeping track? Is there somebody in charge? Do you have a plan in place? And are you keeping people safe? So Tony, with that, I'm going to turn it back over to you to see if there are questions for Henry, Neil, or myself.
Fantastic. So we do have one. Miss Kim. We love Miss Kim. Kim asked a question, says, can you talk about, and you may have already talked about this, can you talk about the protocols for bringing someone who tests positive back to the workplace?
Ted, can you address that?
Absolutely. So the first thing is you've identified them and you've isolated them. So if they've reported at work, obviously you've got to isolate them. You have to advise them of the CDC guidelines. And then it's a little bit unclear, but it's either 10 days or 14 days. So I would use the 14-day CDC rule from when somebody reported to when they can return to work. As they come back to work, there's the testing and there's the attestations. Every day during their 14-day quarantine, you want them to attest to, do they have a temperature? Have they been around other people that they may have spread it to? And do they have any of the symptoms? And then when you bring them back to work, you make sure that they are symptom-free, that they've had a test. And Neil, do you want to talk about when you bring back for the testing real quick?
So for an individual that has been identified as having had the disease, when they come back to work, they should probably have both tests done. the antibody to identify if they actively have antibodies, and again, the PCR to make sure that they are not currently active. Now, if they are negative for PCR, they don't need to be retested again because they are not showing signs of current disease, both via DNA or RNA or symptoms. And if they show antibodies and they're not IgM antibodies that are currently active, they should be okay. And again, policies are changing on that. So employers may want to retest occasionally for those individuals because we don't know how long those antibodies hold. But for the most part, I would say they're good to go.
Fantastic. Thank you, guys. We have another question, and I probably want to chime in on this one. Addressing people's fears too. So I know that all of you that are on the line here, if you're in the position of HR, this is all within your domain, making sure people feel safe and taking in those inquiries. What I've seen is that communication is key right now, and being consistent, showing people you have a plan, documenting that plan, having enough posters, making sure your leaders, your managers, and supervisors, I tend to see that tends to be the biggest challenge is really having them look at these new habits and enforcing them as well. I've actually seen a lot of my clients as well put together almost a communication piece and a video and saying, here are all the things we're putting in place, basically taking your plan and making it real and showing people what you're doing. And also too, it's, I think a training document to say, here's how we have it set up and here is the new normal in regards to the cleaning procedures, right, Ted? And then weekly cleaning procedures. And here are the third parties that we're using. I think the more we can educate, the more we can have communication signs, also to giving back and saying, hey, I know mental health is critical right now as well too, and giving them those little pieces of education as well. I tend to see when I am seeing and talking to some employees and getting their, I guess, take on, do you feel safe? And it's been interesting to see people going, I don't even know what they're doing, versus, no, I'm very clear in regards to expectations. I know my expectations for myself. I've been just trained the other day. I know what the next training session will be next week. And here's the 3 other trainings that we just did last week. Those employees tend to feel a little bit more safe and secure because they're seeing it, they're hearing it, they're feeling it, but also too, it's a policy that is now truly being enforced. So that's what I've been seeing. So Kim, thank you for that question as well too. And you know, I think, I don't know if it was Henry or not, the whole retaliation thing too, when people are coming back, you know, you almost have to be like, anticipate there's going to be a little bit of bullying and maybe some comments as well too. Get in front of that, or actually just be like, hey, if this were you, how would you want to be treated? Right? You know the characters within your staff, right? You know the ones that are going to be piping up. So try to get in front of that. And then also just say, if these things do come up, I am here for you as well too. Anyone else like to share in regards to addressing people's fears?
You know,
Sure.
Tony,
You know,
Tony, if I may, Henry, and then I'm going to have to jump off because I have another call at the top of the hour. Just a couple of things, Tony, and to the crew out there. Number one, transparency. You know, Henry and I and Neil are dealing with big companies and some that are unionized. And there's this fear that companies are hiding, and they're not, that are hiding something from, so the more transparent you can get. And the second thing is bringing in experts to help you explain this. My hunch is that most of the folks who are on the phone don't have a medical background like Neil and can go into what these tests really mean. You know, they may not have the regulatory background that Henry and I have, and helping people explain. So, you know, I'm not trying to make a push. You can call us, but I'm not trying to make a push for the services we offer. But sometimes it's helpful to have other experts in the room helping you to answer questions. And with that, folks, I want to thank everybody for their time. I know Neil and Henry and Tony are going to stay on, but I do have to run right now. And so I want to thank everybody. Thanks again.
Thank you, Ted. Thank you.
That was a TED Talk.
That was a TED Talk, yes. So thank you all. I really wanted to convey a few things to my clients that are on the line here is have a plan, have a policy, enforce the policy, and train, train, train. What I've been hearing from some of my clients is whether it be at the health department, a county official coming in, they're asking your employees, when was the last time you were trained? Also, too, when we're looking at workers' comp renewals, all the carriers want to see what your protocol is. I don't think we can do enough training right now. And also, too, it'll show to your employees that you are committed to a safe work environment as well, too. Housekeeping items, IIPPs have changed. They have been updated as of July 1st. If you don't know if your IIPP has been updated or it is in compliance, please let us know. We also, if you are not doing training on a weekly basis or every other day basis, please let us know. We have a full library of pandemic trainings available to you. So please reach out to us so we can give you that. And again, you're making safety real. Also, too, for those folks that are here, Henry, Neil, Ted, they're with Hew and Associates. They are your one-stop shop for consulting, compliance, doing a self-audit to make sure that you have everything in place, and also your testing resource as well. For those of you that I need a resource for PPE, they've done all the hard work. So if in this time of need where you need one person who can kind of give you all of these pieces during this very complicated time, I'm so blessed and honored to have this partnership with Hew and Associates, with these fine gentlemen here that were online as well too, to help all of you in your time of need. And so again, you have all of their information there. We look forward to seeing you also too on our next webinar as well. Still staying on the COVID trail. I apologize. I scare because I care. You all know that. You're like my babies. We are seeing just a huge uptick in the number and types of claims right now as it relates to cyber. It is almost doubled as it relates to hacking, the dark web, and because a lot of people are working home office. Join us August 13th, 10 a.m. so we can give you kind of the latest and greatest how to protect yourselves. And also, too, we'll be doing analysis with your own email and to let you know any sort of vulnerabilities as it relates to your own email as well, too. So, again, wanted to thank the gentleman, Neil, Henry, Ted, who is double booked,
Yes.
for coming on today. I appreciate it. Folks, please, please, please reach out to them, ask them questions. Again, if you need an expert, if you just want to know, am I doing things correctly here? Please reach out to them. That's why we've partnered with them. I know a little bit of a lot of things, but I don't go into a huge deep dive. That's why we have the experts here to help you all. So Neil and Henry, thank you so much for being on today. For all of you that are on here, we will be giving you a copy of the slides. Please reach out to them. And as always, please let me know how we can help you. Please stay safe. Please stay well. Please stay productive and take care of one another. All righty. Have a good one, guys.
Thank you, Tony. Appreciate it. Thanks.
Bye-bye,
Thank you.
guys. Have a good one.
Okay, thank you.